We are very pleased to have all of you join us, that this is a strange space perhaps for some of you to be in, and we hope that this event is still all of the things that you've come to expect from this summit. As Steve mentioned, this is our 6th year for this annual conference, and we expect and hope that it still will be about meeting new partners, learning from communities, and jumpstarting new ideas. For us, this event and all of our work is focused on partnerships and how to better intersect housing with other areas to improve life outcomes. Some of you may remember from last year's summit or seen the recordings, and we are recording today's and tomorrow's events as well. Our keynote speaker, Dr. Kamara Jones. So she really brought the audience to their feet with her compelling message about systemic racism and its countless manifestations in the 3 sectors we focus on: housing, health, and education. All of you know that those things are inextricably linked. Dr. Jones implored us to talk candidly about race and racism, to not shy away from those uncomfortable conversations, and to work to actively dismantle racist norms, practices, and systems. We believe that this work is even more critical in the face of the state of our current world. Those already existing disparities and systemic racism are even more stark as they've been exacerbated by COVID-19. We hope this conference is a space for all of you to continue and increase your vital efforts and the role that we all can play in helping to dismantle inequities.
Not a year after Dr. Jones's address, we have borne witness to a global event, the coronavirus pandemic that reached nearly every corner of the planet, and it laid bare the racist inequities that have defined intergenerational disparities in health outcomes, healthcare access, educational opportunities, and homelessness, and beyond. No effective response to COVID-19 could gloss over the disproportionate impact the virus and the resulting condition of COVID has had on communities of color and Indigenous peoples. The same goes for the issues that have been brought to bear in the last week as hundreds of thousands of Americans took to the streets to demand immediate and comprehensive action to dismantle systemic racism, stop anti-Black bias and violence, and enacting police reform. In the next 2 days, we want to bring this imperative to our conversations around important issues. We could say especially now, given the events of the last week, but that would diminish the constant oppressive nature of racism. What we can all do is be more honest about the heart of the issues we care deeply about. The summit is intended to be a space for open dialogue, active listening, and constant learning, whether we're around banquet tables or communicating digitally like we are this year. We are pleased to welcome you to this, our first virtual summit and our 6th annual summit, and can't wait to hear from our incredible panelists and attendees. Before moving on to our opening remarks from Sunia Zaterman, our executive director, and Stephen Norman, our board president, we want to thank our sponsors for this event. And I just want to add a personal comment here. When we were trying to figure out what to do at the summit, moving locations or canceling or moving to this virtual space, our sponsors have been incredible. When you put an event on like this, you worry about making sure sponsors are happy and they're part of the event. And they were incredibly supportive of this effort. In fact, one of our sponsors came to us when we went virtual so that they could help out. So I just want to add a special note of thanks to our sponsors. One of our presenting sponsors, United Healthcare, Community and State, we will hear from them tomorrow morning, but they have asked to not speak this morning in recognition of the events of the last week. Instead of taking up we gave them a few minutes to speak. They wanted to acknowledge what has happened. So I will read their statement. United Healthcare thanks all the PHAs and their partners for their tremendous efforts and commitment to serving those most in need in our communities. And we respectfully ask for those inclined to use these moments for reflection. Thank you. So let's just take a moment to honor that. All right, and it's my honor to introduce our our three other sponsors today. First up, we have Tony Pass from KeyBank Capital Markets. Tony, if you want to.
Yeah, thank you, Steve. I appreciate it. Hello to everyone. It's kind of funny how this is becoming the new norm. Abra had to help me log in because I was apparently in my kindergartner's class Zoom room. So thank you, Abra, for getting me into this. Okay, but thank you for having us. I wish we were all together right now, but given the circumstances, like Steve said, my name is Tony Pass. I'm a senior vice president with KeyBank Capital Markets. I'm based out of Seattle, Washington. My primary focus is on Key's housing authority platform. I work with another colleague out of Columbus, Ohio, Sam Adams. He and I are essentially the face of KeyBank's national housing authority platform. I focus more on kind of the bank products. So think treasury management, any sort of credit type requests. And then Sam works on the capital market and bond executions. There's a couple marketing pieces attached. I don't want to slow this down, but I just want to thank everybody. I look forward to the day we can all be together and shaking hands. I see a lot of familiar names on the attendee list, and yeah, I just would like to thank everybody. I appreciate it. I'm looking forward to the conference. Thanks, guys.
Great, thanks, Tony.
Yeah.
Next up, Nathan Ryder from CareSource.
Hello, good afternoon. My name is Nathan Ryder, and I'm with CareSource. And CareSource is a nonprofit managed care organization. We serve approximately 2 million members across 5 different markets currently. So as of today, we're in Ohio, Kentucky, Indiana, West Virginia, and Georgia. And the different products that we have are Medicaid, Medicare, we're also in Marketplace, and then we serve several of the dual eligible of Medicaid and Medicare. And it was about 5 or 6 years ago that we actually branched out into our social determinants of health, or SDOH, brand approach called Life Services. And within that, we have several pillars that we focus on: workforce development, housing, food and nutrition, special populations, and advocacy. And so I am the strategy lead on our housing team, which is kind of what brings us today with the nexus of health and housing. And several of our housing goals, I'll just mention really briefly, and then we can connect later. But housing affordability for our members and the community. We also work to leverage our financial resources and investment tools for both the development of and preservation of affordable housing. We work with partnerships with national housers and agencies across the country. And then we're also advocating for new and unique housing programs to produce greater housing stability. So that is very briefly in a nutshell, kind of why we're interested, why we're engaged in the conversation. And we have partnered with multiple public housing authorities in different areas. And if that is something of interest to you to kind of bridge that gap as well, please feel free to reach out. You can find me in the app, you can connect with me on the sponsor website, and we can set up a time to chat further. Thank you.
Great, thanks, Nathan. And that's a good reminder. At the bottom of your screen, you'll see we have a direct link to our sponsor listing. So if you go to sponsors.housingisummit.org, you'll see all of the profiles for our different speakers, and you can request a follow-up conversation with any of the people here and our representatives from United. So next up, I'm going to introduce Cynthia Bates from Reframe Housing, which is a housing software company.
Hello, everyone. I'm Cynthia Bates, and I'm very excited to join the summit. This will be my first year attending the summit. Reframe Housing is a brand new startup IT development company. We recently acquired the licensing rights to an existing software platform that has been used historically by public housing authorities to administer choice voucher programs and specifically moving to work programs. So we're just entering into the marketplace, and this is just a wonderful opportunity for us to kind of immerse ourselves in all things housing, get our name out there, get our brand established, and really I'm just here to listen to you guys. I want to understand, what is going on right now in public housing, and obviously everything is healthcare related. I think this is interestingly very apt given what we're going through as a global planet. And so I'm just excited to be here, and welcome.
Great, thanks so much, Cynthia. And just again, I just want to emphasize how fortunate we have to have you all as sponsors to this year. And we look forward to connecting with you throughout the conference. Like I mentioned, people can find our sponsors on the app. There's information, a couple of different handouts and things like that that are connected to their profile. So please take some time to check those out. With that, I'm going to hand it over to Abra to introduce our next speakers.
Next, so pleased to introduce the King County Housing Authority Executive Director, as well as CLPHA's Board President, Stephen Norman.
Unbelievably timely, considering the horrific murder in Minnesota and what is going on in terms of dialogue in our streets and across our nation. Today marks our 6th national convening, our first virtually, that's dedicated to the premise that decent, affordable housing is a critical platform for so much of what we're struggling to achieve in order to create a just and equitable future for all people in this country. Public housing, public education, public health, income and wealth inequality, pervasive, systemic, and institutionalized racism, educational and health disparities, homelessness, social and geographic mobility. These issues are all incredibly connected. That's a given. The discussion over the next 2 days is about how we actually connect these dots. The conversation could not be more timely. The disproportionate impact of COVID-19 on Black and Hispanic households has exposed how unequal our healthcare system is and how the lack of adequate housing predetermines health outcomes for poor people, people living on our streets, in shelters, in unsafe and overcrowded conditions, how people of color in our community are getting sick and dying at higher rates than virtually anyone else. Adequate housing is an essential start to healthcare. The shift to virtual learning online has highlighted the digital divide and threatens to exacerbate the learning gap between rich and poor communities. The role of our on-site after-school programs in poor neighborhoods has never been more important. Data continues to validate and refine our understanding of the determinants of success for poor families, and particularly the roles that strong placemaking and geographic mobility can play in supporting life outcomes. We have housers, educators, healthcare professionals, researchers, foundation officers, advocates, people with lived experience, all of them under this virtual roof today. We all have a common cause. This conference is about mobilization for that cause on both the local and the national level. We must continue to grow our local partnerships, to learn each other's languages, to share data, to adopt common metrics, to deliver efficient, effective services across systems, to scale up best practices. Today and tomorrow, you'll hear from many on-the-ground practitioners who are doing just that. And on the national level, we need to mobilize. We need to get angry. We need to cross-advocate for each other's issues, to push federal programs that cross silos between federal departments and boundaries between appropriations subcommittees. We are far more powerful as a united front. Council of Large Public Housing Authorities, CLPHA, is very proud to be at the forefront of this, and I thank all my fellow housing authority practitioners who are on this call today. My thanks to Sunia Zaterman and to Steve Lucas, Abra Lyons-Warren, and Kristen Greenwald, the CLPHA staff, for pulling all this together and for pivoting so nimbly to a virtual forum. And a big thank you to our sponsors, KeyBank Capital Markets, which successfully took the Housing Authority to a $140 million bond sale earlier this week, to United Healthcare Community and State, who has been moving personal protective equipment out to housing authorities across the country, to CareSource, to Reframe Housing, and special thanks to funders for housing and opportunity. I'd like to close this with a quote from a paper entitled Housing and Health by Lawrence Valor, who was serving at that time as the Secretary of National Housing Association. Valor concluded his remarks by noting, in the last analysis, it all resolved itself back to the degree of intelligence and enlightened public sentiment, which are to be found in the community. Still, the outlook for the future is hopeful. We are passing out of the dark ages of sanitary science. Health and housing are receiving each year increased attention, increased thought. We are rapidly ceasing to be barbarous America. Unfortunately, those remarks were written in 1911.
Yeah.
As I drive past tent encampments every day here in Seattle, where the median annual family income is $105,000, I can't help but think that we actually haven't come that far in the past 100 years. That these inequities continue to exist a century later lends the conversation today a clear sense of urgency. So thank you all for your commitment, your passion, and most importantly, you work every day in the communities we serve. I look forward to this conversation. Abra, take it away.
Thank you. So next I'd like to introduce CLPHA's Executive Director, Sunia Zaterman.
Dear friends and colleagues, welcome to the 6th Annual National Housing Is Summit. Housing is education, housing is health, housing is justice. I'm sorry that you can't be with us today in Washington, D.C., but there are thousands of peaceful protesters in the streets today and all week demanding justice. So people across the country are in unity on this issue. I first want to start with thanking the CLPHA staff, in particular Steve Lucas and Arbor Lyons Warren, who so seamlessly moved from an in-person meeting to a virtual platform with record-breaking registration. And of course, our support from Kirsten Greenwald and Trina Maynor, and the entire CLPHA staff for supporting this effort. I'd also like to thank again the sponsors, United Healthcare, KeyBank Capital Markets, CareSource, Reframe, and particularly funders for Housing and Opportunity, and Jeannie Fakata Selassie for their support for this work, this most important work. I'd like to begin my remarks with a quote from James Baldwin. "Not everything that is faced can be changed, but nothing can be changed until it is faced." I'd like to address the events of the past week that have roiled our nation's conscience. The death of George Floyd once again reveals this nation's centuries-old, enduring stain of racism. Our hearts are with the Floyd family and the families of Trayvon Martin, Michael Brown, Eric Garner, Breonna Taylor, and the multitudes of Black men, women, and children who have paid the ultimate price for this country's systematic and lethal racism. We as a nation cannot move forward until we right the wrong of racial injustice. This means understanding, acknowledging, and dismantling our sanctioned systems of deep structural inequality. With our nation facing the deadliest pandemic in more than a century, unemployment rates equal to those during the Great Depression, and now the tragic murder of George Floyd, America's deep racial inequities have been laid bare. Black Americans are 2.5 times more likely than whites to be killed by police. The latest overall COVID-19 mortality rate for Black Americans is nearly 2.5 times higher than the rate for white Americans. If they had died of COVID-19 at the same rate as white Americans, about 13,000 Black Americans would be alive today. COVID-19 related employment loss hit Black Americans far worse than white Americans. Black households have only 10 cents in wealth for every dollar held by white Americans. 30% of Black families still live below the poverty line. These deep structural inequities can and must be dismantled. Our work today and going forward is to build a movement with cross-sector partners in housing, health, and education that rethinks how these systems can work collectively to achieve racial justice and equity. Let our collective work across sectors lead the way so we as a nation can breathe again. Thank you for joining us.
Thank you, Sonia, for those remarks, and Stephen, thank you. I think our goal in kicking off this event with these remarks is to really center us for the day and the next 2 days that we'll be all together. With that, I'm going to hand it over to Abra to introduce our panel.
Great, thank you, Steve. Yes, so I'm very pleased this morning to welcome our cross-sector crisis response to COVID-19 plenary session. So this, we hope, will really be a, of course, timely, but also forward-thinking session for you all this morning or afternoon, depending on what time zone you are joining us from. So you'll be hearing from representatives from the housing, education, and health sectors on what this has looked like for them so far, what they're anticipating for the coming months, and for the future in terms of emergency response, and especially working with partners. So with that, I'd like to turn it over to Lachelle Dozier.
Good morning. Can you hear me okay?
Yes, we can.
Great. First of all, I really would like to thank CLPHA for inviting me to speak at our Housing Is Summit. This has always been a fantastic summit, and I'm so excited that it's virtual because so many more of my staff have an opportunity to participate. So really looking forward to a great session. So today, the topic of our panel is really important because it really does speak to all of the challenges that we as housing authorities have been facing over the past few months as it relates to COVID-19, and knowing that the people that we serve are those who are most at risk. In Sacramento, we have those same type of concerns here today. We're trying to really help our residents. A little bit about Sacramento. We're one of the 5th largest housing authorities here in California. We provide affordable housing to about 50,000 residents. 30% of those residents are seniors. A little bit over half all have a disabled family member, and about half are families with children. So when the COVID-19 pandemic hit, we were most concerned about reaching out to our residents and finding out what the issues were, with a specific focus on our seniors. So our seniors, we knew would have challenges in terms of being able to get around. So we did make sure that we reached out to them to find out what their issues were. And one of those was food insecurity. So that's going to be the main topic of my focus that I'll talk about in terms of the work that we've done in that regards. Even before the pandemic hit, we already had a robust partnership and working with a lot of different social service providers, working with the county with their Meals on Wheels program. So when we reached out and said we have a problem in terms of our seniors getting out, the mayor's office came to our assistance in the city of Sacramento and really put together a program very, very quickly. They used some of their city funds to really work with 5 of our local restaurants. And these were very high-end restaurants, and the meals were some of the things that weren't your blue plate special, but they were really great meals, and they really wanted to make sure that they could feed our seniors. So we worked and pulled together a partnership not only with the restaurants, but also we had to work on how do we get the food to our seniors within a quick amount of time. So that's where paratransit came in. So our local regional transit stepped in and started to make sure that they could help us with deliveries. We also worked with our Meals on Wheels program. Many of you probably have that in your jurisdictions, where we could expand that. So these 5 local restaurants provided meals for our seniors, and they were 3 meals a day and groceries. So they provided a bag of groceries that people could use throughout the week. And then they gave them very, very hefty meals that really lasted them quite some time. So we were very excited about that. We were able to really fund quite a few seniors. We have about 725 we were delivering to them door to door. So with all of the work and assistance from many people coming together, we were able to put this program together. So on the next slide, I think it will show, yeah, there we go, that it was an 8-week program. We were able to deliver to 11 of our housing communities where we have seniors. And like I said, 725 families were served. In addition to that, because the program only lasted 8 weeks, then another program came online that we were able to take advantage of that was very similar. And on the next slide, it does show our next program, which is called the Great Plates. And this was one that our governor, Governor Gavin Newsom, delivered throughout the entire state. 30 restaurants were involved. So this was an opportunity for our seniors and really anyone who really had some food insecurity to actually determine which restaurant that they were interested in receiving meals from. They got pre-cooked meal kits every day. And there's over 1,000 seniors that have enrolled citywide. So we were very excited and glad that once our other program came to an end, we were able to fold right on into this other program that was sponsored by the state of California called the Great Plates Delivered. So just a little bit to also just mention about what we did as a housing authority in response to COVID-19, and then I'll turn it on over because I want to make sure I stay within my time allotment and we have enough time for questions and answers. As I mentioned, outreach was key. We really needed to make sure we understood. So we called all of our seniors, all of our residents, and started talking to them about what they needed to do and what types of things that they needed help and assistance. That's how we knew that this was one of the big issues for our families. And then because our seniors are really isolated, we set up a plan where we would call them on a daily basis or every 2 days just to do a check-in and make sure that they were okay. In terms of looking forward, as a result of all of those calls and outreach, our next thing that we're really going to focus on is education and working with our families and children. We know that that's a huge challenge. And so I think that really does speak to some of the other speakers on my panel who will be talking about education as well as health. But those are the main things that we were doing here in Sacramento. And I really wanted to make sure that we highlighted the issue about food insecurity. Thank you.
Thank you. Kirsten?
Thank you, Director Dozier, and thank you for the powerful opening remarks. My name is Kirsten Wyson. My pronouns are she, her. I'm sitting in unceded land from the Duwamish and the Coast Salish tribe, and I'm planning to gather at 9 a.m. on Saturday with other public health workers and healthcare workers in support of the protesters as we march from our public hospital to our city hall. In addition, I have worked at Public Health Seattle, King County for 23 years. I'm so delighted to talk with you, and cross-sector work is how we make change to eliminate racial inequities in our country as well as other oppressions. From a COVID-19 perspective, King County, Washington, and the Seattle area. And many
says hello.
Yay!
I ran into him in the hallway. The elevator was getting ready to open and I thought it would be you, but it was him, so.
That might be me. Let me make sure all my things are closed. We have reduced the spread of COVID-19 and really made it through the first wave, but it does continue to have a slow burn. Within households, we are seeing more cases within workplaces and among essential workers. Many, many fewer, thankfully, after amazing levels of work in our long-term care facilities. A little more community transmission and other close housing settings with shared bathrooms and shared kitchens, which relates to housers' work. We do see systematic inequities. For us in King County, actually Pacific Islander, rates of infection are 6 times higher than whites. Latinx are 4 times higher than white. Black is about 3 times higher than white. And the data we have with Native American is twice as high as white. And I just want to say that COVID-19 affects everybody by far with absolute numbers. over 2,000 white King County residents have contracted COVID-19, and the next highest group, Latinx, is about 700. Next slide. Here's where we can see. So the COVID-19 on March 1st emerged in King County, and you can see the rates quickly took off for Latinx and Pacific Islanders, as I just mentioned. For us, Black, as I said, is about 3 times higher than white. But you can see here the cases, and I do want to stress that COVID-19 affects all of us, you know, on this whole beautiful planet where we live. And 2,600 cases have been among white residents and 1,600 or so among Latinx, and you can read the rest of the numbers. Next slide. Of course, health is not all that affects us, also jobs and stable housing for our well-being and our education, but we also see similar patterns of racial inequity falling out for us in unemployment, with our Pacific Islanders experiencing, receiving more likely to have unemployment, as well as our American Indians and Black residents in King County. Next slide. I did want to talk a little bit about how our public health response, which I joined in late January, worked to do cross-sector work, and we leaned into our existing relationships deeply. We appreciated, as if it were gold, our past work with our housing authorities, King County, Seattle, and Renton Housing Authority, as well as the nonprofit housers. In particularly data across sectors for health. We say data spreads at the speed of trust, but all the work in the relationship building really helped our housing task force, which is one of the 10 task forces listed here. Each of these task forces, and task force is a kind of a strong word for what happened. They were kind of work groups and almost like little beta test groups that met initially daily for the first 2 or 3 weeks in February, and then have mostly moved to weekly and bi-weekly. And it's almost like a focus group or a test group with your really familiar partners to have two-way communication and test messages, which we would then use in bigger webinars later in the week to include more people. Next slide. One particular change, COVID-19, and I think the racial inequity protests of the last few weeks offer a chance for profound change and permanent change, and policy windows are opening for us in the Seattle area. That does mean more housing for people who have been homeless. We have many housing beds for people who need to isolate and quarantine for COVID, and we have more beds for people to not be so crowded in our shelters. Last slide. But the flip, of course, is the economic devastation as well as the virus's health toll for us in the health setting and for everybody. In our region in King County, we are now back at almost 12% of adults uninsured, and that was even a month ago. And that is before the Affordable Care Act expansions were rolled out in 2014. So we're really going to have to use our imagination to recreate the world that we want to live in. And I'm very pleased to turn this over to the next speaker, Eric.
Good afternoon, and for those on the West Coast, good morning. Thank you for the opportunity today. My name is Eric Peterson. I'm the Senior Vice President for Policy at the After School Alliance. The After School Alliance is a DC-based national nonprofit that works to ensure that all young people have access to quality, affordable after-school and summer learning programs. And we do that through a variety of means, including primarily through encouraging partnerships at this state, local, and national level. Again, thank you for the opportunity to be part of this panel and this gathering. This is actually my 4th Housing is Summit, and I really feel it's one of the events through the year that really is essential in terms of bringing together all the different sectors to see how we can truly advance change. So after school and summer learning programs, quickly keep children, young people safe. They inspire them to learn. They give parents, working parents, peace of mind. They help children learn, grow, reach their full potential, and offer new learning opportunities. It's important now and really all days, though, that we all work together to ensure children, regardless of race, income, or geographic area, have access to quality programs, both summer, after school, before school. And that resources expanding programming, closing opportunity gaps, and helping programs be the best they can for our children and youth. Today, but too many young people are missing out. Today, about 11.3 million children are on their own in the afternoons, have no access to programs. And that was pre-COVID-19. And for every child, essentially, as you can see in the graphic, waiting to get in, there are in the program, there are 2 waiting to get in. The pandemic has made the challenges around access even greater. After-school programs, while they're still around and working really hard to meet the needs of children and families, they look very different than what they did a couple months ago, and will continue to evolve and change. This spring has been asked to talk a little bit about what programs did this spring, and then we'll look to the future in terms of how after-school program partners, as well as programs run by housing authorities, may evolve as we get into summer and then really into next school year. If we can go to slide 2, programs have really risen to the moment. We did a survey in April to get a sense of what programs are working on. So 16% of programs were serving children of essential workers. So they had opened and oftentimes all day and extended days to provide programming for school-age children, and some after-school programs expanded to where there wasn't access to early care, expanded early care as well. Slide 3, 78%, or next slide, sorry, 78% of programs converted their operations to virtual learning. Oftentimes that was online where accessible and where they're able to work with partners to provide hotspots and devices and access. But it also was old school and sort of what we like to call retro kits in some communities, or other kits that were provided to families as well. And often cases, those virtual programs were not just 3 to 6 p.m. as historically after school has been, but really all day long. The programs also increased their professional development and training offerings for staff in a number of areas. Next slide. And then 37% of programs were actively delivering meals. So similar to my colleague from Sacramento, focusing on seniors, many programs were working to use the USDA child nutrition programs to provide meals, not just to students, but to families as well. Often in partnership with local school districts, but often in communities where there needed to be more access than what school districts were able to offer, actually delivering meals to houses as well. And then also programs are checking in virtually by phone, in some cases in person through front porch visits. They're doing wellness checks, just reaching out, working with students, but with parents as well. So linking parents to community partners and resources, helping parents navigate the online learning platforms that school has switched to in many parts of the country, and also helping programs provide homework help to their children as well. Let's go to the next slide if we can. So, but for all the access, there continues to be a tremendous amount of challenges for programs, particularly around access to funding. Programs are struggling to stay afloat. So our survey also found that about 75% of programs felt like they were at risk of closing or permanently laying off staff. In particular, that's programs who rely on charitable donations, but also grant-funded programs. And then the programs that rely on local and state funding are particularly concerned about, as we move into summer and to fall and new budget years, what that will look like for them. At the same time, while the funding is a challenge, we anticipate increased demand this summer and fall for virtual and particularly in in-person programming. And a choice poll found in mid-April that 69% of parents are concerned about academic loss, 61% concerned about a loss of after-school activities, And that's really around social isolation for students. So a May poll by Learning Heroes found parents were most worried about their children missing social interactions. That was 59%. They're also concerned about someone in their family getting COVID-19, 57%, and as well as academic losses, too much screen time, access to food and financial security were there as well at 30 and 40%. The good news moving forward is there's a good foundation to build on. It's the partnership work that we're going to be talking about, in the discussion is there, but also the legacy of federal funding for after-school programs through things like 21st Century Community Learning Center will help be able to provide supports to students and families, hopefully moving forward. So the learning support, the life and work skills, the workforce development piece, the skills like character, collaboration, time management, all those skills that young people need, particularly for programs going into middle and high school, to help students be successful, not just in school, but in life as well. In terms of looking forward for the field, the stark reality is the economy and businesses can't reopen if parents have to leave their children home. And so if parents can't return to work with school out, the need for after school and summer programs, as well as childcare for younger students, will just continue to grow. We still see lots of providers in states where reopening has started and they're into phase 2 or phase 3, in some states phase 4 of reopening, where programs still don't have the resources they need to be able to safely serve young people. So that need for funding and need for support is going to continue, and again will be an opportunity for partnership together. Parents are nervous about the safety of activities and programs, and we're really going to have to sort of reimagine what programs look like and reimagine schedules and partnerships so programs can serve students and families. After school programs, we know will need more staff to accommodate smaller staff-student ratios. We know they'll need more training on safety and sanitation, but also on trauma-informed care. More space due to social distancing requirements and the ability to run programming all day long. All those, of course, require additional funding. While learning loss from the spring is important and needs to be addressed, equally important is the social emotional learning that supports the mental health and wellness checks, access to caring mentors and staff that students are going to need as they transition back from being at home this spring into the summer and fall, being back in programs and in school. We feel like we need to think big, bold, and completely outside the box about a comprehensive learning day. If we can switch to the next slide and the final slide here. It's really trying to figure out when and where and how our students can learn in a hybrid of academics and enrichment that may be partially in person, partially virtual. We know out-of-school programs, including those run by housing authorities and partners, need to be at the table for reopening discussions. We need to bring in all our partners, Parks and Rec, museums, libraries, faith-based institutions, higher ed, business community, career and tech centers, public health, camps, and of course housing, in addition to schools. And all of this, again, means more time, more space, more staff, and leveraging those resources that we know are out there and in new and creative ways to address this. So not surprisingly for this convening, partnerships are critical, and we're happy to be able to launch into discussion with the group.
Okay, great. Well, I really appreciate, the comments from both Kristen and Eric about what's going on in the various communities. One of the things that I've noticed that emergencies like this often allow organizations to really call upon those existing partners at a moment's notice. So those people that you've had a long-term relationship with. How has your organization established new relationships and really worked on trying to pull from existing relationships to respond quickly? I know here in Sacramento, because we had such a good relationship with both of our local elected entities, we were a natural. They called us first because they knew that we were very connected to a large number of needy individuals. But in your own communities, how has that worked?
This is Kirsten, and we started with the relationships developed in our emergency preparedness work and our emergency operations centers, the Seattle Emergency Operations Center and the King County Emergency Operations And I, as a public health person for 20 years, I've been at the health department and I have worked on chronic disease, social determinants, and anti-racist work. I had not paid very much attention to my preparedness and infectious disease colleagues. So I was also kind of drawn into this method that they use, incident command structure. But I do have to say, and I was quite skeptical at first, but you do what you plan. And a lot of our infectious disease and preparedness people were just tapping into muscle memory almost. There have been 8 major outbreaks in the last 10 years, H1N1, SARS, MERS, Ebola, Zika. So this was a very familiar response to them. I kind of came in with the outreach liaison branch, our community mitigation and recovery branch. And we had to kind of be quiet and listen for a little while to hear what the preparedness people were saying. At the same time, they were not used to community-driven practice that centers people closest to the problem who are often closest to the solution. So then there were a few weeks where they really had to listen, and we said, no, we're not going to do a top-down way. And all of our task forces will have half outside community partners and half inside government staff. I think a lot of sectors like housing, education, childcare, sectors, community-based organizations that we had existing relationships kind of got off the ground more quickly. And where we had to find new relationships for us as a public health department was with the business community. So we kind of delegated big business coordination to the Seattle Chamber and to a group, Challenge Seattle, that was led by our former governor, Christine Gregoire. And then we focused on small business, but that's where I felt like we were a little slow off the bat because we didn't have the existing relationships in place. And curious what you think, Eric.
Thanks. Yes, similar experience. I think we had a lot of partnerships already in place that we've relied on and used on. Our work, again, as a national organization has been more on the policy side and support side rather than the local community level, and providing, sharing best practices for groups at the local level. In terms of the partnership piece on the policy side, though, a lot of the allies that we've formed partnerships with, we were able to go to those. And so the national after school providers, the education groups, and community childcare as well. You know, the Council for Chief State School Officers and National Governors Association, who worked with in the past, have really been working with more closer now and being able to speak to those groups around flexibility of existing funding streams, in addition to the need for additional support and funding. I think the one to the, you know, similar experience in terms of also identifying areas where we hadn't spent the time to really build partnerships. We had a little bit, but not to the extent that we needed, was with the business community. And so one thing that this has done, though, is while I think it's important to have those partnerships that were built already in times of crisis or need like this, it does provide the opportunity, I think, to knock on those doors, and knowing that folks on the other side are also interested in partnering and sharing what they're working on as well. And so we have been able to do that with like chambers of commerce and the business community to be able to work together, again, around the economic piece of meeting childcare and school age care, after school care for young people in order for parents to go back to work. And the business community really sees and understands that, and has been a great partner to work with.
Okay. Well, one of the things, you know, and we, Kristen, you talked about this, is the impact, the disproportionate impact that this has had on, you know, our minority groups, African Americans, Latinx, and I think your slides really illustrated a lot of the challenges. And while we know that COVID-19 affects everyone, this really has provided a lot of disruptions to work and school and all of our routines, and really our families who are already struggling is pushing them back further. How do you think that we as an industry and partners should be looking at moving forward with our work in terms of equity, and how do we try to not only make up for what's going on as far as the pandemic, but we also have this other huge issue going on in terms of social equity and the protests that are going on that people talked about at the top of the hour. How do we mobilize our resources and work more effectively in this arena?
Thank you, Lachelle. And just the heads up that I want to hear your answer too. This is such a good question. You know, for me, and for having worked for 20 years in public health and on racial inequities, and our county for 10 years has had a law on the books that our county government needs to use racial equity impact analysis for our budgeting and policy decisions. And I see, you know, we are moving in the right direction. We are literally 10 years into our equity and social justice ordinance. And, you know, there's still so much work to do. For COVID-19, to me, it offers this opportunity to improve our practice, our public health practice and our policy practice when we center people who are affected because the boundaries of their solution are so vast.
Okay, I can hear her.
And, I'll try to speak up a little bit. For example, let me just say within Pacific Islander, you can see we have small numbers, 156 Pacific Islanders. Clearly what our public health department is doing and trying to communicate around COVID-19 has not been working for Pacific Islanders. We know from past relationships and with measles outbreaks that Marshall Islanders in our region are very disconnected from our institutions for very good historical reasons, including nuclear tests in the 1940s on the Marshall Islands and our military bases in the Marshall Islands. So, I mean, if I were a Marshall Islander, I would be looking at my community. I would not be looking at the American government system. So we now, in the last month, are working with 4 elders from the Marshall Island community, 4 elder women, to just step back and listen and hear what solutions they know about to get COVID-19 messages out to Marshall Islanders. Similarly, for what I can do around racial equity, and I do think that Black, Indigenous, and people of color have specific equity issues that need to be addressed in order for us all to have the beloved community and have the place where we want to live and where we want our children and where we want our grandchildren to live. So for me, I am learning by stepping back and by participating in our department's White Caucus and relying on white people to give me advice about what to do right now, because I believe that our Black leaders have their hands full and they are leading this movement in this moment. And so I'm in support. But Lachelle, if you are willing, I would love to turn that question right around at you and hear your answer.
Okay. Well, and here in Sacramento, one of the things previously before this occurred, we had a high incidence of Black infant mortality. Black infants were dying at 3 times the rate as any other ethnic group. And one of the things that worked was there was a focused attention that was made by our elected leaders to say that this is something that we're not going to continue to tolerate. And so then they put not only resources, but they went out into the community and they started talking to and communicating with the community to find out what the real issues were. So I think in terms of, at least from my perspective, if we really want to get to racial equity issues, we need to talk to the people who are most impacted. We need to hear from them. They need to tell us what are the challenges, what are the things that you need. Because of that particular experience, it changed completely over a very short period of time. And we no longer have Black infants dying at the rate that they were because of education, outreach, and getting out into the community and using the community as ambassadors. So to me, I think that that is the same approach that we need to start doing and moving forward as far as racial equity is concerned. So that's my response, and thank you. Eric?
Thanks. Agreed. I think one of the things we've been looking at on this. So yeah, as an organization, particularly on the policy side, that does a lot of policy work, is looking at access to resources and the inequities there. I mean, the system set up to ensure that funding goes to sort of the same programs and not necessarily the communities that need it the most, not necessarily to programs that are at the community level run by Black leaders, by peoples of color. And so trying to address that at the all levels, but for us, particularly at the federal level, an example of that is, and again, not always intentional, but sometimes intentional. One of the examples is a lot of the federal funding streams that can be used to support after school programs are reimbursement models, right? So the challenge there is a lot of programs at the local level that maybe not necessarily have the capacity to advance or forward fund and then wait 60 or 90 days for the state education agency to using those federal funds to reimburse them. So we've been looking particularly at the CARES Act funding, so the federal COVID response resources, where we know again that the challenges and the communities that have been hit hardest really need access to these funds now, and they need access to the funds up front and not going through a reimbursement process. So an example with the Child Care Development Block Grant dollars, which although can be used for 0 to 5, 45% of the children served by that are school-age children. Working with state agencies to be able to provide those funds in a way that's grants or contracts that are provided up front, again, to address some of the challenges and barriers that we've seen where, again, programs that are most in need that have been historically left out of some of those fundings can be addressed.
One of the things that I want to address, and I know we're about to go to questions and answers, so I guess this will probably be one of our last things, is that if you could see a major policy change in your sector, how would you prioritize that and argue that that is an imperative change that needs to be made to address COVID-19?
Thank you. That's a good question, and I'm excited to go to Q&A. One specific one is to have COVID-19 testing and treatment be publicly funded the way children's vaccines are. It's just, this is a technical term, but it's kind of a cluster F to have it tied to insurance and some of the publicly funded healthcare programs. So we just need a radical simplification of access. And then another one is that I believe all people need housing in order to have good health. Thank you.
And it won't be a surprise, I'm going to come back to the funding issue because resources are so critical. I would say in terms of policy change, increased federal, many things that need to happen, but increased federal and state funding, and particularly targeted to communities most in need. Right now, only 18 states have funding specifically supporting after school and summer programs. And where they do, it's often school focused, and that's important, but also community-based organizations, housing, and other entities, Parks and Rec, libraries that are serving communities need to have access to some of those funds as well. At the federal side, the 21st Century Community Learning Center program, which is the only funding specifically dedicated to after school, summer, and before school programs, only serves 1.7 million children. That's at the height of it. It's about a 20-year program, but about 10 million young people are eligible for those funding and could be served. In terms of the cross collaboration piece, that's key because those funds can go to a wide variety of eligible entities, including housing authorities, including all the ones that I mentioned, faith-based and small community-based nonprofits. The other piece I'll just flag in terms of policy that we're tracking at the federal level is the AHEAD Act that Senator Murray has done, where it really focuses on the cross-collaboration piece with sort of housing in the center. And so looking at other policies like that, where we could try to break down some of the silos and allow the funding mechanism, again, as was mentioned early on in the opening remarks, to break down, those artificial barriers set up by the appropriations committees and different agencies to be able to come together, knowing that for a young person and for families ultimately who are the recipients of programs and services, it doesn't matter where that comes from. The point is having it work at the local level for young people.
I think, Eric, you raise a really good point in terms of the silos with funding. And so from my perspective, one of the things that I think is most impactful that really encourages this cross-sector collaboration is when the federal government breaks down their own silos. And so I shouldn't be so concerned, and I feel it's such a shame that when schools kind of collapse, our children had no way to eat, that I'm trying to figure out how to feed seniors. And so if at the federal level, we can get out of these different silos and we can start to learn how we really reward our local communities for collaborating. One of the things that we have is our Sacramento Promise Zone that really does force collaboration, not only at the local level, but at the federal level, so that different federal departments are talking to each other and saying, oh, hey, we understand that you have a program for an after-school program. We should pair that with, the USDA funding for food, or whatever those things happen to be. So to me, the most impactful thing would be for the federal level to start rewarding this type of collaboration that then pushes it down to the state as well as the local level, that we in turn could really take advantage of. And like you said, our residents, they don't care about where it's coming from. It's just a matter of, how things are delivered and do they get what they need. So I think with that, I think we're on time. Abra, we're gonna go to Q&A, is that correct?
Yes, so I think that folks, if you'd like, we've had a couple questions come in, but if you'd like to go ahead and type in the chat box, which you can find with your control bar at the bottom of your screen, if you're on a computer, or at the top right, if you're on a tablet. I think we have also a manageable enough number of participants that if anybody would like to virtually raise their hand, which you can find, again, in that toolbar, we can try to call on some folks to actually speak as well. I think though, while we're waiting for just a couple of those to come through, Lachelle, if you wanted to do another question with Eric and Kirsten.
Okay, yes. In fact, there is another one that I really did want to get to, and that was kind of looking forward into the future in terms of where we're going. So there's a lot of speculation about how things are going to look very differently after this pandemic. And I know we talk about that in terms of just how we do our work as housers, how we interact with our clients, and how our staff really, is situated to serve those clients. So maybe we can talk about, from your various institutions, how do you think things will change as a result of COVID-19?
I want us to probably be prepared to live with COVID for a little while, for months or years. The Spanish flu of 1918 kind of moved into our world and stayed to some level. COVID-19, it is pretty darn tricky to develop a vaccine for a cold virus. A coronavirus is a cold virus. There's only 7 cold viruses that have hopped from animals to humans, 4 that give us the common cold, and then SARS, MERS, and COVID. I do see treatment improving dramatically. I mean, our healthcare system is just kicking in heroically and through science, a little bit similar to AIDS, where it used to kill and then became a chronic condition. But the fire metaphor, COVID will be some burning embers, and for us in our region, we seem to have had the wave and now the slow burn, where the numbers have just kind of held steady for cases. The deaths have gone way down, almost to zero. So more and more people have had COVID-19. I've had COVID-19, very, very mild cases. In 80% of our cases, it is a very mild illness. Sadly, I gave it to everyone in our household who also had mild cases. So I do walk through the world, I think, with less fear, which may not be well-founded if we find out that immunity doesn't last forever, but I think I have some immunity. But it also really makes a virtual option more real for education. But there's a lot of redesign. I'm not a futurist. I mean, I love to listen to people who can imagine into the future. But I also see these policy windows open, around city mayor policy opportunities, county exec policy opportunities. In Seattle, we've now eliminated our curfew after our mayor met with our protest leaders yesterday. There's really a lot of work for all of us to do. I'll leave it at that.
Great. Eric?
Thank you. Yeah, I think if we do, I'd like to try to be optimistic. So I feel like while there's a lot of challenges, if we do it right, it's an opportunity to really model and alter the learning day for all young people, with access to smaller classes, things that we've been trying to do for a long time, more positive youth development, more social emotional supports, and stronger partnerships between school and community, including groups like housing and community-based organizations. So I think there's a lot of potential there. We've been talking a lot with the formal education community. It's going to be different in different places. Every community is different in terms of how they've been impacted by the pandemic and what they see moving forward. But there certainly are going to be school districts in communities where they will likely do shift scheduling. So one day, Monday, Wednesday, Friday, you'll have some students in classroom, and then Tuesday, Thursday, those students will be doing virtual learning. And when that's the case, again, as I was saying in my opening comments, making sure our community partners are at the table and groups like housing and libraries and others are at the table, because that's an opportunity when those students are virtual learning. We learned a lot from virtual learning, I think, both informal education and formal education. There are some positives, but there are also a lot of challenges that are going to continue to be with us. So on those days, say Tuesday, Thursday, when those students are virtual learning, if they can be with a community partner in a setting, the museum community has talked about how those have been closed, and there may be an opportunity to open those up for students. So looking at new spaces, new partners, housing is a great one because it's right there where students are when there's program space within the housing authority units. So I think there's a lot of opportunity there, again, for even more closer coordination with the formal school community, with teachers, to be able to provide additional learning opportunities. Children continue to learn, throughout, whether they're in the classroom or not. But how can we best support them so the learning really, again, sparks their imagination and provides them with, passions to move forward as they get older.
Great.
Thank you. And I think kind of going along with that, there's been a question about how you all have changed or upgraded technology as a result of kind of these new ways. So Eric, you were talking a little bit about some of the ways that, how we've presented out of school time programming has changed. Can you address the technology piece of that?
Yes, absolutely. I can do that briefly. So technology access to things being a big challenge for formal and informal education. Lots of school districts were not prepared. And the homework, what we call the homework app, has existed for a long time before this, but it really shined a light on it, where students don't, and by homework app I mean students don't have, and families don't have access to broadband or to devices or to connectivity, or there's one device for the whole family or two when all the children in the household need access for computer work. So, I think partners have stepped in. There's been some progress on that. Policymakers have stepped in at the state and local level around that as well. Hopefully the federal government will step in as well in the next legislative package that hopefully will move forward this summer to address some of that and again, the funding cost issues. But I think what we've also, and two other quick things there, I think. One is, one thing that we're working with state partners, with statewide after school networks on is where devices have been provided or hotspots have been provided to families during the school year. Normally those would get turned in for the summer, and working with local school districts, but also state education agencies to say, can we leave those devices and those hotspots with families this summer? Just have them continue them, and that way that learning can switch over to community-based partners, to after school program providers who are doing virtual if they can't do in person in some communities, and being able to again partner and share those services and devices. And then the other thing I'll say really quickly on the technology piece is the much for sort of there's a program in South Carolina that calls them retro kits, but a lot of programs are doing this where it's actual, things like Legos or things like scavenger hunts or project-based learning kits that families can do at home that are provided often when the meals are picked up or delivered for communities. And that doesn't take the place of the technology or the virtual learning. But we've heard a lot from parents and from programs where is such a thing as Zoom overload, especially for students where they just want to step back and turn the screen off and have something that they can do together with student and parent, child and parent together. And so we've seen a lot of that as well. And again, it's all about creativity and trying to solve the needs.
So if I could just, Abra, speak to technology from the Housing Authority point of view, some of the things that we have had to do on our resident side was increase our communication. So we are putting in monitors in all of our public housing communities. And so we're going to start pushing notification, pushing information out. It'll be information about, the changes we've made in our office hours, changes about healthy living practices as a result of COVID. So we're making sure that we really amp up our communication to residents in a way that is not face-to-face. In addition, just on the staff side for technology, there's many things we've done differently in terms of teleworking, but we do temperature checks of everyone who comes in or out of any building that we have. So we make sure that we're keeping people safe and healthy and really trying to use technology in a way that it's, as Kristen said, that this is kind of this thing that's going to be, we have to learn how to live with it. So we really have to change our practices in a way that is not just, oh, COVID solved and it's all over. No, this is kind of the new normal going forward.
Great. And I think going along with that, can you speak, Lachelle, just a little bit more about how you all contacted residents to even figure out in the first place what their needs were?
Okay, so we use a very, very sophisticated technology called the telephone, and we just called them. We literally just started calling people and saying, hi, this is the Housing Authority, we're from the government, we're here to help. But we essentially had our staff, because our staff were working remotely, and we started just systematically going through and calling, which also then spoke to how many people we did not have their information. But yeah, that's essentially what we did. And then we said, would you like us to call you back on a daily basis as a welfare check, or every 2 days or every week? And then they would tell us, it's like, yes, I'd like for you to check in with me, every few days or every day. It all varied. But yeah, that's kind of how we just got started, was picking up the phone.
Great. And I don't know, Kirsten and Eric, if you all had anything you wanted to add in terms of how you were connecting to the folks that you were trying to reach to ascertain what their needs might be.
Just real quickly from the health department, we post as much as we can on our website. Obviously, most people in King County are not monitoring our website. So we do try to push out, and I would just say we're most successful when we work through existing trusted leaders and partners, whether it's in different sectors or different ethnic groups or race ethnic groups or in different geographic locations. So it's really a network of networks that seems to work the best, including multiple channels, text, phone, virtual, and we kind of almost live in horror for the number of people that we know that we're not reaching, and keep trying to reduce that.
Yeah, similarly for after-school programs at the local level, we've heard from them. Telephone has been key, where online, access hasn't worked. There's been a lot of coverage about sort of the students that went missing over the spring that sort of are not showing up for online classes, and that's been we've seen a lot of providers working with schools to identify who those are and then really make an effort with those, whether they were part of their after-school program or not, to figure out how they could be helpful to those families. And see what the challenges and barriers were. Sometimes they're technology, but sometimes there's other things, or lack of access. Sometimes there's other things going on. So I'd say, where possible, email and chat, but then phone call. And then again, a lot of programs that are doing front door, porch checks or from the front lawn, visiting houses and checking in on them, seeing if the students need anything. And the big thing has been from that we've heard, anecdotally is, again, parents, wanting help with providing homework help or providing figuring out what their students should be working on, should be doing, connecting them with teachers when that connection wasn't there. That's been a key role for community-based after-school providers during this, as sort of being not unlike during regular after-school programs pre-COVID, as sort of being that intermediary and being that connector. For parents and students at the school.
Great, thank you. So I do see that we have a couple questions still coming through. Perhaps our speakers might be able to drop some responses in the chat. We want to make sure that we're staying on schedule. So I'd just like to very deeply thank our panelists today. Thank you so much. This was really a fantastic session. You can see from the chat that folks, I think, were really appreciative and engaged with what you were sharing with all of us today. As a reminder, this is recorded, so if you'd like to review it at any time, we'll have that available in the coming weeks, or share it with colleagues who maybe weren't able to join us. So thank you so much to the three of you. We really appreciate it.